Welcome everyone, my name is Barbara Flory, and today I will be discussing some themes that are the premise of a book called Why Hospitals Should Fly, written by John Nance. As the title implies, Mr. Nance is encouraging healthcare systems to adopt the management methods pioneered by the airlines beginning in 1970 as a result of a huge airline disaster at a place called Tenerife. That particular disaster occurred because a captain who was very highly esteemed in the industry made several significant errors, and it resulted in the death of over 500 people. But the really upsetting part was that his crew and co-pilot were aware that he was making mistakes, could have stopped it, but they did not because they were concerned about offending the captain, and it was just in that particular culture at that time, it just was not done. You did not question the captain. He was in charge and you never stood in his way of whatever he was doing. But clearly that was the wrong thing to do, because as a result of that mentality, over 500 people, including the captain and the crew, died that day. So the three concepts that I'm going to be focusing on today are patient safety, crew resource management, and elimination of waste. First, patient safety. Healthcare is provided by humans, and we all make mistakes. So, as Mr. Nance pointed out numerous times in the book, it's not about eliminating mistakes, because that will never happen as long as there's human beings involved. The point is to identify the mistakes and stop them before harm comes to the patients. And the way to do that with the crew resource management or the airline management method is to involve the whole team and stress that everyone is responsible for safety and no one is above anyone else when it comes to ensuring safety. One of the things that is very strongly encouraged is that physicians and clinical staff work closely together, and they must have the mentality that questioning something is not an insult to anyone. It is simply to improve the methods and ensure patient safety. So when there are mistakes identified, the whole team should look at them together, not to assign blame or determine who did something wrong, but to determine how they can avoid those mistakes in the future and eliminate other chances of harm coming to patients. So for the crew resource management, that is actually something that has been formally transformed into methods that can be taught to healthcare teams, particularly people in the OR and when they're doing procedures and that sort of thing. I know some of the areas in the organization that I work for have had formal crew resource training, and I've heard very good feedback from it. Apparently it works well in practice, and it's not just something that is talked about but really doesn't have a large impact. It does seem to have a big impact. One of the things with the crew resource management, and that Mr. Nance stressed repeatedly, was eliminating the halo effect, which is the idea that someone in healthcare generally would refer to a physician, a surgeon, someone in a very high leadership position. Because they are well esteemed, have all of this training and power, and are very well respected, it means that everything that they do and say must be right and they never make mistakes. And that is the halo effect. And of course we all know that some of the people who might be seen as having the halo, the worst offenders of that halo effect are those people themselves. So it's a very big job to get everyone on board because of this prevailing mentality that the physician or the high-level leaders always know what's right and are always in charge, and that is to be challenged, according to Mr. Nance, and strongly encourage everyone at every level to be empowered to stop the process or question an issue or a concern in the interest of better health care and patient safety. Getting everyone on board is a little bit of a different story, but it can be done, and there were several examples in Mr. Nance's book of places that had actually accomplished a good system in that manner, and they did in fact see a big difference in patient safety, reduction of harm, and overall patient satisfaction was much better. So not an easy challenge, but it can be done, and it's definitely worth trying. And the final theme was waste elimination, which was also discussed in Mr. Nance's book. And in his example, he used a regular med-surg inpatient floor and explained how this particular floor was redesigned and moved away from the private room, flat screen TV, gourmet meal, 5-star hotel model that we're seeing in a lot of healthcare systems now, and returned it to more of a ward type patient floor. And it's very similar to an ICU unit in that the nursing station was in the center, the beds were spiraled around the nursing station, and part of that was efficiency and part of it was safety, but the efficiency and safety were very strong in that the nurse could see all of her patients or his patients from the nursing station, rather than having some of their patients down the hall around the corner where they cannot see or hear them. And the patients can also see the nursing station from their beds, and it just improved safety a lot, but it also eliminated a lot of waste for the nurses in that they were not constantly walking around the floor trying to get to all of their patients because they were all centered right there around them. Other areas that they also eliminated waste in that particular setting were they kept supplies and materials, things of that nature, in the rooms or at the nursing station, so the nurse or an aide or someone didn't need to be going to the supply closet and trying to find what they needed. It was all stocked right there at the station. And one more thing that they discussed that was somewhat novel, but I found it to be very interesting and I would strongly encourage it, is they went through their charting system and determined what really needed to be charted and what didn't, and eliminated everything that did not really need to be charted. They pointed out that most of what gets read in a chart are the things that are required by law to be there, and the rest of the notes that are written, especially from the nursing units, they're never read, and they're essentially useless because a lot of it is just repeating the same thing over and over again. And they stress that if you just write the important things or the things that are required to be written, and if there's any changes or improvements or the patient takes a downward turn, obviously those things you need to chart because those are the important things. But the little mundane everyday things, such as, the patient is still breathing, it's a waste. It's a waste of the nurse's time, and no one ever reads it. So obviously, if the patient's still there, they're still being treated, but there's not really a need to go on about every little thing that happens in the day. And that saved a lot of nursing time and allowed them to spend a lot more time in one-on-one patient care, and also to actually see in real time any mistakes or potential harms that come to the patients. The end result was an increase in satisfaction in patients' satisfaction ratings as well as staff, and that the staff portion was helped immensely by the fact that that particular hospital returned much of the decision power to the nursing staff and the nurse managers themselves, and allowed them to determine what would work best, what would be their best bet for saving time and providing safe patient care, which goes back to the lean premise of going to the Gemba, and who better to know what is going on and provide information and fixes for things than the people who are actually doing the work, which makes a lot of sense, and I, of course, am am in strong support of that, as I believe most people are, but it's much easier to say and than to put into practice. So it does take some work, but it can be done, and it does work really well. In summary, so automation is great, but in the end it's still all about people, because they provide the care, and it should be about people in healthcare because it needs a human touch, and regardless of how good your electronic medical record and your equipment is, it's still, you're healing people and you need a human touch. But because you have such a strong human component, there is also a continuous opportunity for mistakes, because we are all human, we all make them. So the goal is not to eliminate mistakes, but to eliminate harms and learn from our mistakes, work together as a team, not assign blame, and not assign halos to people who are really just people. Listen and watch out for each other. It was another strong theme. Work together as a team, which, clearly, again, is easier said than done, because everybody has their own mentality, own personality, and it's not easy, but it needs to be done, and it can be done. Nothing should be taken personally in a situation like this. If someone is doing something and someone else points out a potential flaw or error, it can't be taken personally. It's about the patients, and it's about safety, and there's no room for personal ego, which again is much easier said than done, especially as you get to the higher level. It's very hard to get that buy-in from the physicians, but with enough work and the right kind of support from leadership, it can be done. And that is strongly encouraged. It improves satisfaction, safety, and it's just a better healthcare delivery system overall. That concludes my discussion for this evening, and I appreciate your time. I hope you enjoyed this information, and I wish everyone well. Thank you.